helping to make your life easier. Local every day.
We continue to learn more about climate change, air pollution, and the effects on the human body. Today we are talking about the effects on asthma and allergies. Dr. Hannah Newhouse is an allergist immunologist with Allergy, Asthma and Immunology Associates. Nice to have you here today, doctor.
Thank you for having me.
So what are some of the effects of air pollution on allergies and asthma?
So we have found kind of over time that with the rise in air pollution, such as exposure to kind of ozone and particulate matter, there has been, that has contributed to a rise in the number of allergic disorders. We know, for instance, that children increased exposure to pollutions has caused an increase or been associated with an increased risk of childhood asthma. And part of that is because children just have, don't have quite as a mature immune system, but then also they actually breathe faster than adults do, and so they just have more exposure to those particulate matter. Otherwise, we can see with more high heat days related to climate change, you can also see the increased risk of wildfires, and with that puts a lot of kind of smoke and into the air, and so then with that, a lot of patients with asthma can struggle with that as well. Otherwise, we see that with increasing kind of high heat days and longer pollen seasons, that the pollen seasons are actually coming earlier and lasting longer, so that can affect those patients that have allergies. And then otherwise, if patients for more of those kind of severe weather events like flooding, you can have more mold exposure, and so then with that, that can also affect those patients with allergies.
That can trigger it as well.
Exactly.
All right, so what can patients do to minimize their exposure?
Yeah, so there's several kind of apps that patients can use to monitor the air quality index. And so they can kind of use that to gauge kind of their activities. They can try to minimize exposure outdoors when the air quality index is poor. They can try to, if they have to be outside, kind of wear a mask during those kind of poor quality days. And then try to avoid kind of outside time during areas where the ozone is high, or at times of the day when the ozone is high, such as kind of usually late afternoon, kind of high commute times, and then also kind of in the warmer months. But then also kind of having a nice plan in place for kind of what to do if they're having increased symptoms related to pollution exposure.
And have their medicine with them. All right.
Exactly.
Thank you, doctor.
Yes,
all right.
thank you.
And for more information on Allergy, Asthma and Immunology Associates, just go to 1011now.com.